Hi, I'm Dr. DelRe, and I'm going to show you some specific spinal massage that you can do at home on your loved ones. And I'll tell you what I'm doing and why I'm doing it. If you want to bring that over here and kind of zero in on the neck here. Yeah, what I'm going to do is I always start at the base of the occiput where the skull is. You kind of run down your fingers down here past the skull to see where it gets soft. And as you run along that ridge, you'll see there's certain areas that vertically are muscle fibers coming up and inserting into the skull, and you'll find certain areas where they're very tight, and so you kind of rub that insertion. Now you have to be careful because those are very tender, usually very sensitive, and that's why they're standing out like that, is because they've been guarding for a long time. And when you rub those, okay, they do have a lot of pain fibers, and so they will be sensitive. And they're also a little bit raw because they've been pulling, trying to guard against something for a long period of time. But they're also very rich in proprioceptors. Those are like 3D position sensors in the joints themselves. And then in the muscle tendons that insert into the bone, you have other sensors as far as muscle stretch sensors, muscle length sensors. Tell that muscle how long or how tight it should be to guard against something. So you work those. And as you're working those, you kind of feel the muscles and see if they're letting down a little bit. And they usually do. And also the cerebellum, which is in the back of the brain, right here, in this area here, that's the central processor. That's like the central 3D processor for the body. And so I always keep a hand up here holding this, just because that's what I've been taught. And I work my way down, and what I do is I go along the spinous processes. There's the little bumps, the tips of the spine of the spinal vertebra. Each vertebra has a little bump there, and that's the tip of it. And what I do is I run my fingers down to the left and to the right of it, and I feel for imbalances, differences between the left and the right. And like in this case right here, I can feel that it's tighter here on the right than the left. And so that muscle that's coming into that bone has been pulling. We wanted to get it to stop that. And so this is kind of like a reprogramming of sorts. So I rub that. I'm going to dig a little bit. Okay, I'm just going to rub and dig, and you do it to patient tolerance. See, she's starting to pull her shoulder up, so that tells me that it's getting kind of deep. So, so I back off, and so I go to the left side and check that out. And what I'm doing is, this is different than massaging into a muscle belly or out here or out here. It's different than going for the muscle belly. I'm going for the sensors, where the muscles insert into the bone, where the sensors are in those tendons and those tight areas. And so they're usually, like I said, very tender, but it doesn't feel the greatest when it's going on, but afterwards the person experiences a lot of relief, a lot of release. And when it's done repeatedly, then what can happen is you can undo kind of like the past. You can, most people have tight areas or problems in their spine, usually have some old injuries that they may or may not remember, even going back to childhood. And so all those sensors and all that network of muscles, that muscles that run maybe from one vertebra to the next vertically, or perhaps diagonally, or they may skip over one vertebra and insert into the next vertebra. You've got this network, this meshwork, and they all have sensors, and they're all been programmed to guard against old injuries that may be there. And so we can actually do a bit of what they call neuromuscular re-education, and it kind of reprograms that when you repeatedly wake those areas up and say, hey, take a look here, you sensors. I'm kind of alerting them to, hey, you've been really guarding here. Are you sure you want to guard that much? And when you do this repeatedly, over and over again, they start to relax and they accept the new positions. It is a type of reprogramming, if you will. So here we go, and I just keep going over again and again, and as I do this, I feel it softening. As I go back up here, the tight spots aren't quite so tight anymore. And I just continue on, going along the left, because that's where I feel most of the tension here. And I'll check the right, too. Mostly it's on the left here, right?
Yes.
Okay, so then we're going to go down the sacroiliac joints here. I'm going to rock that a little bit. Now down here, if you think about it, this is the pelvis, You've got the right iliac bone and the left iliac bone. And they come down, they're the hip bones, so to speak. They come around, they're very big and broad. They start up here and they end up down here. And between these two bones, you've got this triangle we call the sacrum. It's like a triangle, okay? And you've got a big broad joint along here between the sacrum and the iliac bone, and a big broad one here, and those are called the sacroiliac joints. And so I want to make sure that those are moving as well as possible. And so you can rub it, once again, in these ligaments here that hold it together. There can be sore spots, but you can kind of loosen this up a bit just by doing your digging to the patient's tolerance. And then I like to rock. Just get the whole heel of the hand, just kind of rock back and forth a little bit. Just kind of get a good deep motion in those joints, see if they're moving pretty good, okay? And I kind of push up here and push up here. We're going to come back to this later with the softer stuff. But say this right gluteal is very, very tight. It's guarding against something here. Come back up again. This is all really nice and soft. This is staying nice and soft up here now. The tension is gone. Come down here, a little bit of tightness here on the right. You may not be able to get everything out, but you can get an awful lot done just by doing this at home with somebody that needs it. Then what I do is I do a couple other things that are chiropractic that you shouldn't be doing at home anyway, but this is all very safe what I'm doing here. Then how I finish is, and it's nice to have a way for the person to lay with their head straight, by the way. Put up a couple pillows or something like that. Then what I do is I finish with, it's like a soft touch thing. Like some of these sensors, they respond to the deep work I do, but also if you were to rub certain muscle bellies, they may actually become more tight rather than relaxed, because that's how they react. So certain areas respond to certain types of touch and certain types of pressures. And so there seems to be something, and it's hard to really nail it down, but there's something in the body that responds to light touch. And so what I do is I finish up with this. Come to these points right here. There are a lot of acupuncture points along the spine as well. And I just hold them. I just hold this with a relatively light touch. And I just wait now. And I wait for whatever tension's left there to kind of drop. And I feel it dropping right now. And I'll feel it drop either at this finger, this thumb, this finger, or this thumb. Or maybe all of them will just sink. But I can tell it's time to move on, so I'll move down a little bit to the next spot where I feel tension. And I can switch these fingertips to here, and I just wait. Now this is very, very, very good to do with children. Any imbalances, or many, many imbalances you'll find in a child's spine, just with this very soft technique, you will see them actually just disappear, it seems like. They just seem to melt away, these tensions, these tight spots. And that's really nice to do with kids. So the person's breathing and relaxing. I feel this dropping a little bit. So move down. And all I can say is it just takes practice. You start feeling it after a while. I feel tension right here, so I'm just going to wait. I feel this sinking up here, again, dropping. I feel this relaxing a little bit here, so I'm going to move down. There's a lot of tightness up here. It's going to take us a while to get through this area between the shoulder blades.